I am Abigail Halan. I'm the Director of Communications at New Voters. And I started along with my incredible team, the Teens
Sorry.
Get the Vaccine initiative. I'm Abigail Halan. I'm a rising senior in high school and the Director of Communications at New Voters. We started the Teens Get the Vaccine Youth Vaccine Hesitancy Initiative to encourage teens to get vaccinated and inform them about all of that and why they should and basically all the information they need. So our first question for you is, as the sorry, I'm out of breath. As a doctor, you obviously have an incredible amount of expertise on this, and you know a lot about infectious diseases, especially in, I know New York has been kind of crazy as well as Florida has. I'm from Florida, in terms of cases and vaccination. So I think our first question for you is, why do you think that the youth of America is so hesitant to get the COVID-19 vaccine?
Yeah, I think I hear a lot of different things from different people, and there probably isn't, well, there definitely isn't a one size fits all answer. But I think that there are certain buckets that people kind of steer towards, who are hesitant to get a vaccine, and certain trends that we see. Although none of them probably categorizes an individual person completely. But I think some of the things that we see are, youth are sometimes less concerned about getting COVID-19. I've observed, because we know that older people over 60, especially, are more likely to end up in a hospital, more likely to end up dying of COVID-19. But people who are teenagers are really less likely to get severe illness. Not that it can't happen, but it's just much less likely. So I think that that's one of the things that we hear. I think that some people have said that they just don't have enough information, and hopefully over time we can continue to get that information out there, get the word out there, and help people to get the information they feel like they need to get vaccinated. I think that social media probably has something to do with this. Many people's social media are being flooded with messages that are not helpful for vaccination and often wrong. And I think trying to counteract that again with the right information is another big piece of this. And then finally, I think that especially for people in high school, if your parents are hesitant to get the vaccine, it's a big deterrent from high school students getting the vaccine, because ultimately you need them to drive you there, you need them to consent, and that's, I think, a big challenge that we face, especially when there's still so many adults who are ultimately these high school kids' parents that don't want to get vaccinated. And I would say, high school students are really able to look at the data and look at the information. It's all out there. Go online and look for information from the CDC or reputable sources, and you'll find a lot of good information about the vaccine. And make a decision for yourself, independent of what your parents are thinking, if they're discouraging you from getting the vaccine. And you may come to a different conclusion. And I think you should talk to your parents about that if that's the case. In the end, that really might help them, move towards vaccination as well, which is really a great thing, I think, as well.
That actually, I've seen a lot of that with my peers, especially here in Miami, where overall Florida is a swing state. So you have a bunch of people with a lot of different opinions. And parents have been blocking my friends from getting vaccinated because without their consent, they actually can't get the vaccine, even though they themselves want to. And when in an environment with parents who aren't as adamant to getting vaccinated, most of my peers aren't really the ones that are going to be taking initiative and telling their parents, no, I want to get vaccinated, because that's a very difficult position to be placed in,
It
as you
is.
mentioned.
Yeah.
So, can you tell me a little bit about your role as the chief of infectious diseases, which super, super impressive. You obviously have such a wealth of knowledge on this, at New England Baptist Hospital, and how this has evolved during COVID. So how your role has evolved during the pandemic.
Yeah. So I'm an infectious disease doctor by training, and when we've always kind of had a piece of infectious diseases that is involved with preparing for pandemics or epidemics. And so we went through a lot of that with Ebola a few years back, or with some of the other things that kind of come up from every now and then. But nothing really compares to COVID in any of our lifetimes, I think. And it was really early February of last year we started to see that this could be a real threat. When we started to see cases in other countries outside of China, it looked like this was really highly likely to be spreading to other, other regions of the world, including the United States. And at first, we were thinking that we had really good preparedness in the United States, but very quickly, we learned that that was not necessarily the case, and that a lot of our planning was ultimately not fully preparing us for a pandemic like this. So I think early on in that first surge in New York and in Boston, and a little bit on the West Coast, it was really an overwhelming experience, I think, for a lot of people to be seeing these large volumes of very sick patients coming through, intubated, very acute illness, and not knowing, really all the answers that we know now in terms of how to treat people. And so that was an overwhelming period, I think, for a lot of people. There was also, as the chief part of my job, a lot of it is leadership and trying to bring people along who maybe, don't really want to be a part of a pandemic. Maybe they've been working for 35 years as as a different role within healthcare and never really envisioned themselves being a part of a pandemic. Certainly didn't have any interest in being a part of a pandemic, but here we are. And as healthcare workers, we really all needed to step up or it wasn't going to work. And so a big piece of this was really also just kind of being the example and trying to bring people along to the understanding of why we're doing this, what we need to do, and keeping people safe, trying to secure resources when things were really limited, last spring especially, and making sure that we had access to testing and masks and all of the equipment and ventilator, everything that you've heard of in the news. All that was really real. And I think as things have gone along, it's become a lot more about trying to, normalize the care of this disease over time, so that it fits into being one of the other diseases that we treat, and doing it safely. And now we know a lot more about how to get people through the illness. And we still don't have all the tools or answers that we would need, but I think we're a lot farther along than we were a year and a half ago. So we've come a long ways, I would say. And vaccines, of course, help with that enormously. That's been really the biggest change for us.
Thank you so much, Dr. Hollenbeck. I actually have some questions as well that I would love to ask. And thank you so much, you and every single healthcare worker. Your dedication and you're putting your lives on the line for us is so incredible. And we really are all so grateful. Kind of jumping off of that, in your profession, you are probably around and see a lot more vaccine hesitant people than me or Abby do. So how do you, speaking with like doctors that I have met, it seems like such a frustrating experience, but how do you respond to it? And how is it something that you've had to deal with? And how do you generally respond to it when you see it in your patient?
I think mainly I try to listen, honestly. I think I know why, from in my own perspective, it's a great idea to get a vaccine. I think I'm always learning about why people don't want to get vaccines. And I think it starts with trying to listen and trying to hear what they're thinking, what their perspective is. And I think over time, you get pretty good answers for a lot of those concerns. But it starts with listening for where people are coming from, because everybody comes from a different perspective, I think. And I think that's really probably the main thing. It's just you get the answers for why. Those are all out there. I think if you're concerned about microchips in the vaccine or something like that, that's really a very different concern than if you have a moral concern to the stem cells, for instance, that were used in early experimentation that led to the vaccines. So I think that there's very different perspectives that people come with, and it's best to just understand and then try to have the right answers for people as best as we can.
Thank you so much. Do you find that responding with facts or with like a moral plea, or what have you found to be the best strategy to responding to these different concerns?
Probably for me, I think the facts are the best. I think I do see people who are concerned about, even medical things like their allergies, like they're allergic to penicillin, so are they going to have a problem with this vaccine and things like that. And for those kind of things, there's definite facts that can be helpful. And at the end of the day, there's hundreds of millions of people that have gotten these vaccines. And so we have more facts than we have about almost any other medicine, really. A cholesterol medicine would come on the market, and it would take years and years before we have that many people that have gotten that medicine. Any other vaccine that comes on the market, it would take years, maybe decades, before this many people would have gotten the vaccine. So we have a wealth of information about these vaccines just from experience at this point, and we really do know that they're safe, and we can answer very specific questions with very specific answers in terms of data about showing safety. So I think it's very good position that we're in.
Thank you so much. Yeah, and I know that from listening to you, I feel like I'm better equipped to respond as well to some of those things. So why did you choose to get vaccinated?
Yeah, I got vaccinated in December, and I was among the first in our hospital as an infectious disease doctor to get vaccinated, with the hospitalists, the ICU nurses, the ICU physicians, those kind of groups. And I feel like there were several reasons. One is because on a personal level, I am around COVID, and I wanted to protect myself, my family, my patients, because I'm going from patient to patient. I want to make sure that I'm not a vector for other people to get the disease. And so a lot of that was personal. Some of this was really, that as a leader in my hospital, I'm going to be asking a lot of people to get the vaccine, and I wanted to be getting it early on, so that I was, walking the walk, so to speak. And I think looking at the data, I wasn't really very concerned about the data. We saw several large randomized control trials with the Moderna and the Pfizer vaccines that showed such consistent data, really unparalleled, I would say, in terms of seeing like two medicines kind of coming up through different avenues, but very similar technology. And they do large randomized control trials completely independently, and then end up with almost exactly identical results. It was amazing, I thought. The side effects were almost the same. The efficacy results were almost the same. It just showed such good consistency that I think there was a safety profile there and an efficacy profile that looked very compelling to me. So I felt comfortable getting it early on.
Thank you so much. I know personally, and for a lot of my peers, those studies are pretty hard to digest without like a background in medicine. And I feel like there's this resistance to trusting when people who are equipped to understand these studies tell us, actually, this is really great. Like, this is better than anything we've seen before. But the way that you explain it is really helpful and makes a lot of sense. What repercussions, and I know you mentioned this like from the studies, you kind of already answered this, but what repercussions, if any, have you seen for unvaccinated people? What repercussions have you seen for unvaccinated people?
Yeah. Well, I think that there's kind of three categories that this would fall into, and this is evolving over time. The first is just for health consequences. We know that if you're vaccinated, you're much less likely to get COVID. Even now, we're seeing vaccinated people get COVID, but not nearly at the rate that we're seeing unvaccinated people get COVID. So it dramatically reduces your likelihood of getting the disease. And if you do get the disease, you're very unlikely to get sick from it. And I would say that's even more true if you're, in the high school age or college age. If you're vaccinated, you're really very well protected from severe disease or death. And there's also the components of the long COVID symptoms where people have loss of taste or smell or headaches, fatigue, this kind of fog sensation that goes on for months. And that you're protected against that as well if you're vaccinated. So even if you were to get COVID, it does look like you're very much protected from those kind of long COVID symptoms, which is good as well. The second big category is kind of more societal. So I think over time, especially now that the vaccines are fully approved, or the Pfizer vaccine is fully approved by the FDA, we're going to see more and more situations where to participate in society in whatever events you want to go to, or job you want to have, or school you want to go to, we're going to see requirements for this vaccine, just like we've seen for flu or for measles, mumps, rubella in the past. This over time is going to become, I think, more and more required. And so, we see that now with some hospitals or even colleges, I think, looking at vaccination requirements, but even just concerts that you may want to go to, or events that you may want to go to. Vaccination is, I think, increasingly going to be, part of participation for that. So there is that element. And then I think the most important thing really, especially for younger people, is that we aren't going to really move on from this pandemic until enough people are vaccinated. And we're all tired of the pandemic. None of us like living in the pandemic. We all remember when we weren't living in a pandemic and it was better. And I think until we get enough people vaccinated, we're going to continue to see surges. And the surges are where the variants come from. So, the Delta variant that we're living through right now is largely born out of the most recent surge in India. And we're all in this together. The whole world really is. So until we see enough of the world vaccinated, that we are, really eliminating these large surges, then we're going to continue to see variants popping up. And those will continue to have, consequences for our daily lives. So I think the more that we can get vaccinated, just every single person, reducing the chain of transmission of this virus, the more likely we are to put this in our past or have this be a non-issue in our lives. And so that's really probably among the biggest reasons to get vaccinated.
Thank you so much, Dr. Hollenbeck. It's really helpful. And I think that is going to be really useful for our students to take back to their schools. If okay, we actually have a few more questions that have come up from a lot of our student leaders and students been seeing, Abby's been seeing in her peers while asking them to get vaccinated now that she's back at school. So if okay, I'll pass back to Abby to ask some of those questions that she's heard from her peers.
Great.
So one of the main questions I've been hearing is, are you going to get the booster shot? Which is kind of interesting when there's so many people that have yet to even receive their first or second dose. So how would you respond to people who feel uneasy about receiving the booster shot?
Yeah, I think that's it's reasonable to be uneasy about it at this point. We're still waiting on the official guidance for this. I know that the White House has said booster shots are in our future, and many people have already gotten a third shot. But I think that the formal United States Society for Vaccinations hasn't weighed in on this yet. And they're really the group that we all look to as professionals to come up with the most evidence-based, thoughtful view of how we should approach vaccinations in general, any vaccine. And that group is ACIP, and they are expected to weigh in on the booster shots in later in September. So I think we'll all be looking to their recommendations to some extent. And there's still data coming out that's showing benefit to the booster shots. So at the end of the day, I think we all will need booster shots. We kind of knew that from the beginning. We knew that the original 2 shots wouldn't last forever. There was good reason to believe that from 15 years of prior basic science research that existed leading up to the mRNA vaccines. And the fact that we're getting, what looks like 8 months is pretty good, I would say, honestly. It's not that far different than what we expected. Even with 8 months, we see lower antibody levels in people who are vaccinated. But honestly, that's still largely protecting against severe disease. So we're seeing more transmission, and vaccinated people are passing it to other people over time with these vaccines and with the Delta variant. But we're still very well protected against severe disease. So there's still good things there. I will get the booster vaccine when it's my turn to get the booster vaccine. So far we're giving it to people who are very immunocompromised, who have had transplants, and who are on medications that wipe out their immune system, that kind of thing. But when healthcare workers are ready to get the booster vaccine, then I'll go forward with that as well, I'm sure.
Well, you did mention antibodies and knowing how long those would last. That's actually something I've heard a lot of people who aren't medical professionals saying is the reason why they won't get the vaccine. They're saying, oh, I had COVID 6 months ago. I had COVID last year. I had COVID when it first happened. And how do you say, how should we respond to people who claim that because they had COVID a year ago, they're not going to get vaccinated now?
Yeah, I hear that a lot as well. I think what we know about the natural immunity is that it does provide some protection, but that wanes pretty quickly overall. So we've seen, not uncommonly at all, people getting COVID a second time. And that's usually starts about 3 months after your illness. So your risk goes up about 3 months after your illness. So we've seen people get COVID and even have pretty substantial symptoms 6 months or a year after their initial COVID diagnosis. And so that is a thing that can happen, that you can get reinfected. We also know that the vaccines provide immunity in a way that's much better than natural immunity. So your protection, your antibody levels, your likelihood of getting COVID if you're exposed are all better with the vaccine than it is from natural immunity. So there is some protection from natural immunity. It's just not nearly as good as what the vaccine can give you.
And along with the whole natural immunity and being protected by the vaccine, there's even I've encountered so many people being back at school now that everyone's back in person that so we have the people who are saying they got COVID 5, 6 months ago and don't want to get vaccinated. And then we even have a few that have been telling me that they don't want to get vaccinated um, because, no, not that they don't want to get vaccinated, that they don't want to wear a mask because they're already vaccinated. And they're saying, oh, but I'm safe, I have the vaccine, I don't need to wear a mask. And what would you say to those people who are saying that because they're vaccinated, they don't need to wear a mask, even though in my district it's been mandated?
Are you talking about the school specifically?
Yes, school
Yeah.
specific.
hmm Yeah, I think that gets kind of back to what I was talking about before of why to get vaccinated. It's the same sort of principle in that we want life to go on. And the best way to have life go on during this pandemic is for us to do the measures that won't allow this disease to continue to be transmitted. So, right now we know there's probably going to be cases that get passed in schools, right? One student gets it from another student. My kids are in grade school, and I think we're going through the same thing. Surely there's going to be COVID transmitted within the school, and we have concerns about that. But what I really have concerns about is if we have outbreaks in schools. So if there's a low level of transmission, then school classes can continue in person. We can continue with most of the things that we like to do and that are part of our daily routine. We can continue to do with low levels of transmission. When we see outbreaks and big groups of people that get it from, say, unmasked students in a cafeteria, something like that, or there was an example that the CDC published recently with a teacher who took a mask off to read a book, and something like 12 of the 24 kids got COVID from her being contagious at that moment. So we know Delta variant is different, and we have the potential for big outbreaks with this, even among some vaccinated people. And so I think that if we can keep transmission to a lower level, then that's going to be very helpful. And masks play a big role in that. Every layer of protection that you put on, whether it's social distancing, 3 feet, 6 feet, whatever it is, masks, outdoors, better ventilation, and of course vaccines. All of this layers on to allow us to get back to normal life a little bit better. So masks to me, my kids are young. My 5-year-old has no problems wearing a mask. My older kids have no problems wearing masks. So I know we they've maybe learned to live with it more than others because they hardly remember before the pandemic. But I think if we can normalize the mask wearing, it really helps to also get back to a normal life.
And you mentioned your younger children. My little brother he's 8 years old, and he, of course, none of his classmates can get vaccinated, and he constantly expresses this frustration. But with your younger children and people that you've seen that have younger children, how they kind of manage, and how do you manage kind of explaining the importance of wearing a mask to someone who's unvaccinated but can't get vaccinated? So it's the frustration of wanting to get vaccinated, not being vaccinated, having people around them that don't wear masks. So what would you say to encourage that?
Yeah, I think the vaccines are going to come soon enough, hopefully in the next few months for those 5 to 12-year-olds. And for now, I think masks are the best protection that they have, really, in many ways. It's also the best protection that you have with maintaining your normal life, like continuing to go to school, not remote learning, not doing classrooms outside and things like that. I think it allows us to get back to our normal life with a little bit more, a little bit more in that cadence, and just have a mask on. And that, it's nobody likes wearing masks all the time. I wear a mask for most of the day, and it can be frustrating at times. But at the end of the day, you kind of get used to it, and it allows you to get on with your life, which is really the main thing.
That's so true. We say this as I'm here in high school wearing a mask,
Yeah,
making sure
yeah.
everyone else does too. It's the best way to ensure safety. I'm so glad that you said that. I guess our final question for you is, what advice do you have for our high school student leaders running vaccine hesitancy drives at their schools? So they're out there convincing their peers to get vaccinated. What do you have to say to that?
Yeah, I think you're doing a great job overall. And I think just keep listening to people's concerns, helping to synthesize those concerns into, coherent arguments, and patterns so that we can understand, um, what concerns people truly have. And as more we understand about what people's concerns are, the better we can address those concerns. And I think the parental concern is a big one, I would say right now, where there are students educating themselves. They want to get vaccinated, and their parents aren't allowing them to. And I think that that's something where the more we can just keep feeding that education to people, and helping people realize what ultimately what the right thing to do is, then we may see we may see more vaccination among high schoolers, but also their parents, which would be really a valuable thing for all of society.
I've heard very similar concerns to what you just mentioned, that a lot of people have been telling me at the beginning there was the whole infertility myth. And even now people are still concerned, and they're saying, what will this do to my body 10 years from now? There's people who just don't see the importance of it as well. So it's not more of a concern, it's more of a lack of urgency to get vaccinated. Um, and then, of course, there are the parents that don't allow their children to get vaccinated because they're concerned. I think overall for their well-being, and maybe it's just a lack of understanding there of how the vaccine works and the efficacy of it. So I'm so glad that you were able to mention that listening to concerns is the biggest part, because there's so many different reasons why people won't get vaccinated, um, and it's important to hear those out.
Yeah, I would say for the long term side effects, that's something that people had a lot of concerns about. I was hearing about that more early on, but I think I still do hear about that sometimes. And one thing I would say about that is that this is a very short lived vaccine in our bodies. And medicines that tend to cause long term side effects are medicines that you take on a regular basis. They're medicines that you take every day or every week or every month, but not typically vaccines, right? So, vaccines, the side effects generally come up within really within about 6 weeks is about the latest that you would see side effects typically from a vaccine. And so I don't really see that as being a huge threat to us. Even the more delayed side effects that we've seen, like the heart problems in young men, which are very rare, but we do see those all come on relatively quickly too. And I don't honestly believe that we will see long term, like 10-year out side effects, because these aren't vaccines that stay in our body for more than a few days. And at that point, the whole drug part of the vaccine is degraded and not really even in our bodies. So it doesn't really work the same way as medicines that cause long-term side effects. So I think it's unlikely that we'll see those kind of problems.
Thank you so much for sharing that. Your advice of keeping track of what our student leaders hear is really valuable, because we hear so many different things from different people, and even by region as well. Um, so we will continue to note the hesitancy and reasons we hear why people don't get vaccinated, to share that and stop the misinformation, and the spread of all that misinformation. Is there anything else you would like to add, or share any last messages?
No, I mean, I think for the younger people listening to this, if you're in high school, then you really are a huge part of the solution, really in a lot of ways. Vaccination in the younger groups is going to really help us to move past COVID in a lot of ways. It's a large percentage of the population. You have a lot of influence in a lot of ways, about helping your peers get vaccinated, about helping your parents get vaccinated, or grandparents. And I think that you really do play a big role in helping to move us past this pandemic just through the vaccination process. So thank you.
Thank you so much. Thank you so much for the healthcare workers and the people that you lead in all this, because you did say you lead so many people as chief of infectious diseases, and really inspiring all of us, to keep informing people and keeping everyone safe. So thank you, and thank you to all the frontline workers that have been doing such incredible work. Because without you, we wouldn't have information to share, and we wouldn't have people to reach out to. So thank you so much for all that you do, Doctor.
You're welcome. Happy to be a part of this.
Thank you so much.